Hi, I'm Dr. Kelly Harding at Columbia University Medical Center, and this is a part of a series of segments on hypochondria. Today I'm joined by Dr. Arthur Barsky of Harvard Medical School, as well as Dr. Brian Fallon from Columbia's College of Physicians and Surgeons. This segment is entitled, What is Hypochondria? So we might as well go ahead and start with that question.
Well, hypochondria is basically the belief that you have an undiagnosed illness. So, hypochondriacal people have some symptom, some bodily sensation that is disturbing to them, and they think that it's a symptom of a serious disease. And so they're really plagued by this anxiety and worry that something terrible is wrong and it's being missed by their doctors. And they really believe that there's something there that's just not been diagnosed yet and is going to, generally they feel it's going to get worse, it's going to turn into something terrible, they're going to end up crippled or even dying.
But doesn't everybody get that? I mean, if you have chest pain and it hurts and then you feel a little twinge and it's going down your arm a little bit, you think maybe I'm having a heart attack. So does that mean you're a hypochondriac?
Yeah, and that's very valid because it's really true that everybody at some point develops some symptoms and they fear it may be something terrible. But the point that I think Brian is getting at is that hypochondriacal people don't respond to appropriate reassurance. So they go to the doctor and the doctor does a reasonable evaluation and says there's nothing serious wrong with you. And the hypochondriacal person just can't believe it. They know that there's something there and it's just being missed.
It's tough because, if you do have that pain, the doctor says, well, it's nothing serious or it's nothing that I can figure out what it is, and so therefore I think you have stress. How do you know to believe the doctor? How do you know? I mean, that's a serious concern.
And of course, that's the problem because they have a symptom. I mean, it's not like they're making it up. They're not faking or imagining it. They do have the dizziness or the fatigue or the headache or whatever brings them to the doctor. So when the doctor says there's nothing wrong, that doesn't make any sense. You say, well, something's wrong. I've got a headache. I know something's wrong.
So the symptoms are real, but although there's no underlying serious illness that a doctor can find. So I guess that raises the question, is this a serious problem?
I mean, in terms of distress, it can be a huge problem. I mean, people with hypochondria, when they have it bad, they can't focus on anything else. They um, constantly thinking inside their head about the symptom they're having, whether it's chest pain or headache, is it a brain tumor, and they can't focus. So they're sitting at the dinner table with their family and they're thinking about their disease. So they become very narcissistic in that way, focusing on themselves. When they're at work, they're worried, so they can't focus as well on their work. So they may even lose their job because they can't concentrate well enough. Uh, they may stop engaging in normal activities because they're afraid of inducing the symptoms that may occur. So it can be profoundly disabling when it's bad.
So it impairs both their social life as well as their work life
Absolutely,
oftentimes.
absolutely. And it's quite common. I know, Arthur, you've done studies up at Harvard on the frequency of hypochondria, so maybe you could talk on that.
Yeah, it is a very common problem. And primary care doctors are really used to seeing this a lot. And the best studies we have say that it's probably something like 5% of the patients in a primary care practice or a family medicine practice really have a significant degree of hypochondriacal worry. They're really not reassurable very easily and pretty convinced something's wrong. And as Brian says, it really comes to be a tremendously distressing, intrusive condition because you worry, and the more you worry, the more anxious you get, and the symptoms seem to get worse, and so you worry more.
I mean, I've got an example of where we do studies here on hypochondriasis, as you do, up in Boston. And I remember once we drew blood on this gentleman who was interested in participating in our study, and he was so anxious to know the results of those blood tests because I guess he feared that it was going to reveal some awful disease that he called every single Brian Fallon within a 75-mile radius of the Columbia Medical Center, and I live pretty far away. And he finally tracked me down on the weekend. I said, "How in the world did you get this number?" And he said, "I had to call every Brian Fallon I could find in the phone book." And that just struck me as an incredible example of how distressed these patients are, that they go to that extent to try to get the answer. And of course, it was only 2 days after we had drawn the blood test, so I didn't have any results to tell him. And of course, he's had many blood tests before, so he would know it takes days to get the results. But the incredible distress and internal anxiety drove him to that extreme compulsive behavior of tracking me down.
And it must have been very time consuming for him too to track down all those
Yeah,
Brian
imagine,
Fallons in the
imagine.
area.
Yeah,
Wow.
and
Wow.
expensive in all those
And
phone calls.
expensive, it's true.
Yeah, I mean, it's been described as illness as a way of life, that it really becomes a major factor in someone's lives. It's often part of the way they respond to other people. It's what they talk about. It's their medical experiences are very important to them. Because, I mean, just imagine if you thought you had something terrible wrong and nobody could diagnose it. You'd get pretty preoccupied with it too. So it really becomes a real source of stress and strain.
Let me ask you, what about people that, are gym fanatics or health nuts, or are they hypochondriacs?
Well, I see them a little bit differently because oftentimes those folks aren't necessarily worried about disease and worried about an illness that they might have, but they're worried about not being in the optimal state of health lest somehow their life gets shortened. And so they go to the gym to keep themselves in optimal condition, or they monitor their food really, really carefully to make sure they don't eat stuff that has too much fat or cholesterol so they don't die early. Those are more health conscious people. I don't know what you think of those folks. I mean, you can be obsessed about that, but I would see that as somewhat different than the classic hypochondria.
Yeah, I don't think we actually know much about them from a point of view of really serious research. It does seem a little different in that, particularly, as Brian says, what they're really interested in is somehow an optimal state of health. It gets a little close to hypochondriasis, I think, in that they often have this notion that good health is a symptom-free state, that you can achieve this kind of nirvana in which nothing bothers you. And then, by definition, anything you notice that's uncomfortable must be the symptom of a disease. And that gets close, I think, to what some hypochondriacal people believe, which is that anything that's bothersome must, by definition, have a medical explanation. When, of course, it turns out, in fact, that just isn't true. People have insomnia and fatigue and dizziness and dry skin and all kinds of stuff much of the time. And, we really don't know what those things are. They generally get better on their own, and it's never clear what's causing them.
I think I remember from somewhere reading that 90% of people have one unexplained symptom over a 2-week period.
Yeah.
I mean, that's amazing. And when we talk to the medical students, they're surprised by that. But if you focus on your symptoms, you're going to find them.
And if you just think about it, I mean, when was the last time you took an aspirin for a headache, or noticed that your back ached, or lost your appetite for a night, for an evening? I mean, this kind of stuff goes on all the time.